Hello dear viewers, I'm sure you people are watching my lecture on regular basis. So today I will teach you about the methods of ocular drug design. What are the different methods which are used for ocular drug designs? Okay, now let's see here. New ocular drugs, so they are designs aim at improving penetration, minimizing side effects, and improving efficacy. Whenever we are going to design the new ocular drugs, so that is totally based upon in order to improve the penetration power of that drug, in order to minimizing the side effect of that drug, in order to improving the efficacy of that drug. This is prodrugs. Prodrug is activated by the enzyme system present in the eye. Let's suppose lenatoprost is converted into prostaglandin F2 alpha by corneal esterases, and there are some drugs which become active after metabolisms. So here the prodrug is activated by enzymatic system in the eye, and lenatoprost is converted into prostaglandin F2A by corneal esterases. Sustained release devices in gels, collagen corneal shields, and new technology and drug delivery, liposomes and iontophoresis. So these are the new technologies which are used for two designs, new pharmaceutical dosage forms. As we know that about the different type of technologies, like especially through pharmaceutical technique, we are processing the raw material into its suitable dosage form. So how a suitable dosage form is designed? So there are different techniques which are used. So the new technology in drug delivery is liposomes and iontophoresis. Okay, now let's see here. The anti-inflammatory activities, mydriatics and cycloplegics, anti-glaucoma and lubricants. Now come toward the anti-inflammatory therapy. As we know that corticosteroids, so these are the drug which possess sufficient anti-inflammatory activity, as well as NSAID non-steroidal anti-inflammatory drugs. Mastcellstabilzers. Mastcellstabilzer, they are also used as anti-inflammatory therapy and immunosuppressive agents. So all these are anti-inflammatory therapies can be given by these different agents which I have mentioned here. Okay, now come to our corticosteroids. So corticosteroids, they are useful in the control of inflammatory and immunological diseases of eye. As we know that corticosteroids, if you remember, I have already delivered two classes on corticosteroids. So I think lecture number 53 and 54. So you can watch it. So corticosteroids, they are useful in control of inflammatory and immunological diseases of eye. There are different type of routes of drug administration through which corticosteroids can be given. So it can be given in topical form, periocular, vitreals, oral, and intravenous. So corticosteroids, they are also available in the form of infusions that can be given orally to the patients. It can be given to the patient through intraocular route, periocular route, and topical route as well as. Now let's see the anti-inflammatory activities and immunosuppressive action of corticosteroids. Corticosteroids, they are responsible for the inhibition of lymphocytes proliferation with a decrease of the cell-mediated immunity. As we know that corticosteroids, they are also responsible for the inhibition of degranulation of the neutrophil granulocytes, macrophages, mast cell, and basophil granulocytes. Corticosteroids Another anti-inflammatory activity, another activity of corticosteroid is they're also responsible to decrease the vascular permeability, as well as corticosteroid inhibit or it can decrease the prostaglandin productions. Whenever there is any any kind of inflammations, whenever there is inflammatory reactions occur to your body. So during inflammation, these prostaglandins, these are the chemical substances which are activated during inflammations. So prostaglandins are inflammatory mediators. So in order to mimic the activity of prostaglandins, so corticosteroid is also one of the anti-inflammatory agents which can decrease the prostaglandin productions. Now let's see the clinical uses of corticosteroids. Corticosteroids, they are indicated, they are used clinically, they are used in a variety of conditions like for surgical inflammations. They are also used in allergic conjunctivitis and blepharitis. So all these are eye disease. Vernal conjunctivitis, pilectonodular keratoconjunctivitis, deciform and interstitial keratitis. Corticosteroids, they are also indicated for corneal graft rejections. They are also indicated for scleritis and episcleritis, anterior and posterior uveitis. Corticosteroids, they are also indicated for the traumatic inflammation of the eye. They are also used in a variety of infections, diseases like papillitis and retrobulbar neuritis. While corticosteroids, they are also used for the sympathetic ophthalmia. Another disease is herpes zoster ophthalmicus, and this is another disease which is called orbital pseudotumors. So especially in these conditions, these corticosteroids can be preferred. Weak eye syndromes. So all these are the disease of eyes in which the corticosteroid they are used. Okay, now come toward the contraindication. So topical corticosteroids. Topical corticosteroid, they are contraindicated in acute viral infection and fungal disease and ocular tuberculosis and acute conjunctivitis. And then topical corticosteroids, so it should be used with caution in pregnancy and lactations. Systemically, the corticosteroids, it cannot be given in psychosis, headache, pseudotumor cerebri, as well as, and let's see here, this is the general formula. Systemic corticosteroids cannot be recommended for a condition like this. Let's see here. Steroid. This is what? This is steroids. So it means psychosis, headache and pseudotumor cerebri. These corticosteroids cannot be given to any patients if he or she have a problem of psychosis. It cannot be recommended in case of thrombosis, venous thrombosis or T-receptor thrombosis. It cannot be given to the in case of endocrinal suppressed hypothalamic pituitary adrenal axis retard growth and Cushingite state. Corticosteroids cannot be used in a condition like whenever there is retention of fluid and sodium but loss of potassium and systemic alkalosis. And systemically, it also corticosteroids, they are strictly prohibited in osteoporosis and myopathies. Another condition is immunosuppression with secondary infection, especially tuberculosis and fungal. While the last one is D, corticosteroids. So D is for diabetes and hypertension and duodenal gastric peptic ulcers. This corticosteroid systemically cannot be given to any persons. These are the various side effects which are reported after administration of corticosteroids. So these are the side effects which you can see here. So if corticosteroid, they are used in topical form, so it may result in the form of glaucoma, cataract, dry eye. It reduces resistance to bacterial and fungal and viral infection and bacterial infection as well. Scleral melting can be occurs, delay wound healing, and eyelid skin atrophy may be occur. These are the side effects of topical corticosteroids. Another one is systemic side effect. If systemically corticosteroids are used, so there may be chances of oculars, ocular suppressions of the hypothalamic pituitary adrenal axis. Systemically corticosteroids, they are also strictly prohibited in hyperglycemia as well as in peptic ulcers, so it may cause peptic ulcers, as well as this especially after with use of corticosteroids, so it may produce psychotic disturbance, Cushing habitus, and fetus abnormality and susceptibility to infection. So all these are the terms and conditions, all these are the conditions, the disease, these are the side effects which are reported. If corticosteroids, they are used in topical form, so these will be the consequences, while if they are used systemically, so these will be the results. Topical corticosteroids, as we know that topical corticosteroids, they are available in solution form, suspension as well as ointment. Now let's see here, as we know that corticosteroid is one of the topical corticosteroid which is available in 0.5 to 1.5%, prednisolone in 0.12 to 0.25 to 1%, dexamethasone is 0.1%, betamethasone is 0.1%, triamcinolone is 0.1%, fluorometholone is 0.1%, and loteprednol is 0.2%, why as well as 0.5%, and deflofrednet is in 0.005%. So all these are the topical corticosteroids which are available in solution, suspension, ointment, cream as well as in lotion form. One thing I would like to share with my students, that corticosteroids, it cannot be used in powder forms. Maybe chances of toxicity, ADR, adverse drug reactions. So these corticosteroids can be used with precautions, or you should ask from a registered pharmacist. He or she should give you proper advice. Anti-inflammatory activity or anti-inflammatory action of different topical corticosteroid. So the anti-inflammatory activity of acetate is greater than fluorometholone acetate, while the anti-inflammatory activity of fluorometholone acetate is greater than dexamethasone acetate, while the anti-inflammatory activity of dexamethasone acetate is greater than prednisolones, and the pharmacological activity of prednisolone is better than betamethasone. Now let's suppose whenever there is rise in intraocular pressure, so maximum rise due to dexamethasone is 0.1%, fluorometholone is 0.1% is least. Loteprednol is 0.2%, soft steroid. It has minimal effect on the intraocular pressure and systemic side effects. So as I was talking about the use of corticosteroids, so it is minimal. So you can say loteprednol is approved for allergic conjunctivitis and combined with tubramycin at 0.3% for superficial bacterial infection with inflammations. Triamcinolone acetonide at the dose of 40 mg per ml. So this is available in 40 mg per ml Kenacort, which was approved by the Food and Drug Administration FDA in 2007 for intraocular use and visualization during vitrectomy and chronic non-infectious uveitis diabetic macular edema, as well as the retisert Fluocinolone acetylenides used as an intraocular implantation for chronic uveitis. And recent advances now, look at the another corticosteroid that is called Diplo Retina, that is also available in 0.05%, Diplocor and Diplocrets. Prednisolone derivatives in emulsion form exhibit enhanced the strong efficacy and low side effect. So this drug is also indicated in post-operative inflammation in uveitis, and only KID dosing is required. Ozurdex elegans, dexamethasone intravitreal implant 0.7% indicated in macular edema following retinal vein occlusions and non-infectious posterior uveitis. These are the clinical conditions, so this drug can be used. Let's see here. Okay, now let's see this table. These are the oral corticosteroids which are available in a market by different names. These are the generic names: hydrocortisones, cortisone, prednisolones, methylprednisolone, triamcinolones, dexamethasone and betamethasone. Now on the basis of mineralocorticoid activity and glucocorticoid activities, some of them are short acting while some of them are intermediate acting, and few of them they are long actings oral corticosteroids. So these are the oral corticosteroids which can be used orally. So hydrocortisone, which is can be given 20 milligram per day, it has rapid acting mineralocorticoid activity. Cortisone is also available in 20 to 100 mg per day, the same activity which is performed by hydrocortisones or cortisone. Prednisolones, that is also you can say oral corticosteroids which can be given at the dose of 1 to 2 milligram per kg per day, 4 times. This is more potent than hydrocortisones. So remember this point. Prednisolones can be given at dose of 1 to 2 milligram per kg per day, which is 4 times more potent than hydrocortisones. The intermediates oral corticosteroid, that is prednisolone. So prednisolone is also available at 1 to 2 milligram per kg per day, which is 4 times more potent than hydrocortisones. And intermediate, so you can see here hydrocortisone and corticosteroid, these are short actings. These are short acting oral corticosteroids but rapid acting mineralocorticoid. Now let's see here, hydrocortisone is rapid acting mineralocorticoid activity. Intermediates prednisolone. So prednisolones, as we know, this is 4 times more potent than hydrocortisones. This one is more potent than hydrocortisones. Potent means the most powerful, having good therapeutic outcome. The intermediate is methylprednisolones, which is also available in 4 to 32 milligram per day, which is selective than prednisolones. Another one is triamcinolone. So triamcinolone is 4 to 32 milligram per day. This is the only glucocorticoid oral corticosteroids having glucocorticoid actions, not mineralocorticoids. Another one is dexamethasones, which is available in a market by trade name Decadron. So dexamethasone is one of the long actings which is available in 0.5 to 5 milligram per day, which is highly selective glucocorticoid pharmacological activities. Betamethasones, beclomethasone, which is also available at 0.5 to 5 milligram per day, which has marked pituitary axis separations. Oral prednisolones and the dose of 1 to 2 milligram per kg per day alternate days is used to treat orbital inflammations, uveitis, and post-operative inflammation, systemic diseases causing ocular problems. Alternate day therapy reduces the suppression of the adrenal functions. High dose of methylprednisolones which is also available in the form of injections, IV, so they are given in pulses to treat optic neuropathies. Another agent is Diplo. So the name which is given in the bracket, so this is the brand name Dipcort. This is one of the recent glucocorticoid derivative of prednisolone with less complications. Diflizicort is also available in 6 mg of diflizicort equivalent to 5 mg of prednisolones. So this was all about the corticosteroids drugs. Corticosteroids, which are also available in the form of injections and orals and topicals and many more dosage forms. So it was all about the corticosteroid drugs and its clinical pharmacology. Inshallah, in my next lecture we will talk about the non-steroidal anti-inflammatory drugs. Thank you so much for watching my lecture. So if you have any question regarding my lecture, you can directly contact me through my official emails. Wish you all the best.